Can we start?
Yes, please.
Yes. Good evening, Dr. Mahesh Hemadri, Mrs. Nisha, and other fellow staff from Geriatrics Department of NIMHANS, enthusiastic participants from across India. A hearty welcome to all of you for this webinar on smartphone-based apps for successful aging. Today, we live literally on apps world. Even this meeting is broadcast through the Zoom app. It is considered safe to interact with others through mobile applications, commonly known as apps. In some of our minds, a doubt exists about how safe it is for for us, the senior citizens, to use these smartphone apps, especially apps for health benefits. These common there cannot be a better person to clarify all aspects of use of apps by the senior citizens. Dr. Mahesh is specially qualified to talk about it as he is an experienced and practicing geriatrics physician for the past about 30 years. Dr. Mahesh has his basic MBBS completed his basic MBBS in 1991. Postgraduate certificate in hospital management for from the National Institute of Health and Family Welfare. And he has got also a postgraduate diploma in geriatrics medicine from IGNO in 2005. He's working as an honorary faculty physician, honorary family physician in Global Hospital and Rehabilitation Center, as well as Shivamani Geriatrics Camp, all at Mount Abu, Rajasthan. He is a life member of Active Aging, Academy for Active Aging. Incidentally, in fact, we cannot have a better person to talk about that, because once I talk about his qualifications, it goes on and on and on. He has so much experience in this field, in this particular geriatrics field, that he is on a mission to make Rajasthan, Mount Abu, Rajasthan, a specialized city. Which is considered as a age-friendly city as per World Health Organization's standards. And he is also on a mission to take this integrated care for older people of World Health Organization's evidence-based approach for healthy aging. So these are all his special qualifications. Can we get a better person to talk about this than Dr. Mahesh? So I do not like to stand between you and Dr. Mahesh for a long time. Therefore, before requesting Dr. Mahesh to talk about that, I will just make a small introduction about VMS, because I see a number of new faces here. Vayomanasa VMS is an extended arm of Geriatrics Department of NIMHANS, the National Health Organization, National Institute of for Eminence, which is located in Bangalore. So every Monday, every first and third Monday, we conduct webinars on health-related subjects, especially for suited to these old age people, senior citizens nowadays we call them. So in fact, in every session, we have got experts like Dr. Mahesh to speak to you about this. I would request you to kindly attend these sessions, webinars, certainly, and please also inform your friends, so that the mission of, one thing more about us is that we don't market any product, we don't endorse any product. We just tell you what is good for you. We just give you information. Therefore, I would request you, because many of you, to join these webinars and be benefited. Thanks. Dr. Mahesh, the floor is now open to you, doctor. Kindly go ahead.
Good evening. Welcome to Vayomanasa Sanjeevani program. Welcome all of you. Very glad to see you all.
Yes, doctor, you are audible. Go ahead.
Can you hear me?
Yes, doctor, you can go ahead. Yes, okay. You are audible. You are audible, doctor. You are fine.
Okay. Can you play PowerPoint?
Yeah. I'll
Yes,
ask.
sir.
Yeah,
Yes, sir.
she will play. Nisha. Yeah.
Okay.
Nisha, go to the bigger board. Correct.
So today's topic is a smartphone-based app, an adjunct to successful aging, because our ultimate aim to lead a meaningful life is to lead successful aging. So for everyone should aim for that. Now, I will just let you know how this background has started. Next slide. Actually, this presentation, I just presented this poster in Jericon 2023, organized by All India Institute of Medical Science, New Delhi. They accepted our study, and myself and Dr. Gaurav Agarwal, who is a master in public health from PGI Chandigarh, worked on this. We compiled so many apps, and then like presented in Jericon conference. They accepted, and we exhibited this poster. So this is just to show you that we are the part of Jericon team. Next. So as we age towards successful aging, productive aging, active aging, graceful aging, technological innovations has made life more meaningful by virtue of using it. Mobile-based apps is need of the hour for elderly, which extends the helping hand and can lead to successful aging. Practically, both developing and developed countries are in a race of using these kind of apps and improve quality of life in elderly. As successful aging is the process of growing older while maintaining physical health, cognitive abilities, and strong social relationship. Again, I will repeat. Successful aging is the process of growing older while maintaining physical health, cognitive ability, and strong social relationship. Four pillars of successful aging are brain fitness, physical fitness, social and spiritual engagement. These are made stronger by using these apps. Compilation of 57 different apps and making them available for seniors is a step ahead for positive social connectivity. Unlock the potential of healthy aging with our mobile-based apps. Experience the benefits of personalized wellness plan, cognitive exercises, and social connections tailored for seniors. Start your journey towards a vibrant and fulfilling life journey. We have made an attempt to compile various apps based and made to be used by geriatric population, which helps to age positively. Start your journey towards a vibrant and fulfilling life today. Now, the first app which I'm going to introduce you is Pill Reminder Pro app. This handy app sends daily text messages, reminds the person to take right medication at right time. Senior Safety app. It gives alarm, an emergency health information system which reaches emergency contacts and also gives fall alert. Clever Mind app. It educates you those people who are now in case of Alzheimer's. It educates person how to do specialized exercises fit for Alzheimer patients. Lumosity app, exercises for brain cognitive training. Words with Friends app, it's an online multiplayer word game. Equal Eyes app, ideal for people with visual, cognitive, and fine motor skill impairment. Pocket Physio app, guiding physiotherapy exercises. Park and Forget app. So once you install this app, the moment whenever you park your vehicle, it will help you to locate your parked vehicle. Find My Phone app, tracking your cell phone location. It helps you to track your cell phone wherever you are kept. Red Panic Button app. You are in a trouble? Press red panic button. You just have to dial a panic number and phone will send a SMS which contains a Google map. Word Brain app. It's a word puzzle game which increases cognitive fitness. Safe Older Drivers app, developed by American Geriatric Society. It gives assessment and safety strategies for practitioners working with older drivers. Edmonton Frail Scale app. It's a simple tool to assess frailty.
Doctor, 1 second. I mean, if you can just explain what is frailty, that would be helpful, doctor.
Frailty is a generalized weakness associated with sarcopenia. Like it's a kind of, you know, um, is a syndrome wherein all, like sarcopenia, strength, balance gets impaired. So it's called as frailty.
Thank
Okay.
you. Thank you.
So it's a very simple test to assess frailty is ask the elderly person to sit 5 times. Sit and either sit in a chair. Ask him to get down and sit up in the chair for 5 times. If he is able to do, he is well enough to maintain his daily routine activities. If he is able to do, he's frail. But in again frailty, there are different stages like pre-frail, frail, and like something like this, something like that. Okay. So Edmonton Frail Scale app, a simple tool to assess frailty. MediSafe app, use MediSafe app to manage numerous people's medication regimens. It also backs your prescriptions and reminds you when it is time to refill. Dozy app analyzes sleep, vitals, and sleep data. Google Fit app, activity tracking app, and vitals monitoring app. ERM Mindfulness app, it's a meditation app like designed as a mindfulness meditation. So is a mindfulness meditation has been explained previously. Dr. Gop Kumar, like previously he had we had a session from him from NIMHANS, like anyone who would like to learn mindfulness meditation, they can use this app.
In fact, not only anybody, it's a very, very useful app so that anybody can use this mindfulness app. And
Yes, sir.
thank you, doctor. Thank you.
Okay, next. My Life Meditation app, unique meditation and breathing exercises app for self-healing through soothing nature and cosmic sounds. Breathe app for health and fitness. Variety of breathing techniques it shows, and you will be able to assess yourself which breathing technique suits for you. Insight Timer app, meditation app to help and calm mind, reduce anxiety and manage stress. Let Us Meditate app. It's a meditation app. Positive thinking, meditation. Prana Breathe app, breathing technique app is a different kind of breathing technique app. Insight Timer app, meditation app to help and calm mind, reduce anxiety and manage stress. Breathing technique app, this has been already told. Next. Pocket Yoga app, practice yoga anywhere. Different yoga postures have been explained, what to do, when not to do. Tai Chi app, learn Tai Chi modules. So Tai Chi is now becoming very, very famous for seniors to maintain. This has been studied extensively all over the world, Tai Chi exercises. So everyone should learn Tai Chi. And it has been explained very nicely how it helps you to maintain balance for the body, neuromuscular coordination, and mental calmness, quietness, and all. It will help. Care Zone app, manage multiple medications and shares health information. Next. Alzheimer and Dementia Daily Companion app. App gives full information about caring for elderly with dementia. MindMate app offers free brain games and personalized daily workouts that helps to share cognitive functions. Elevate Brain Training app. This app designed to improve speaking abilities, processing speed, and memory skills and mental maths. Left versus Right Brain Training app. It's a video game app. Phobia and Fear Stress Relieving app. This app will give solutions for phobia, fear, and stress. Colorify app, coloring art app. And this gives really pleasure to the senior citizens, like they can fill colors, variety of colors, variety designs. Audible Escape Into app for seniors who have vision problems and arthritis that make holding a book uncomfortable. Excellent narration by wise talent. Words with Friends, to play with friends app and family virtually. With this app, you can challenge friends and family to a game paired with another player. Grand Mountain Adventure app, game app. Headspace app, mindfulness meditation app. Mood Path app, mental health tracking app that asks you daily questions on your emotional and physical well-being. Super Better app is a motivational app that comprises a series of games and challenges. The app aims to get you to build on your strengths and overcome your weakness. Calm app, number one app for sleep and meditation. Insomnia is very common problem in elderly. Nature Sounds app, soothing sounds of nature can help you to relax. Cognifit app. Cognifit is an interactive mental game application that helps stimulates cognitive skills through personalized training. Peak app. Peak is the fun free brain training workout. Peak app uses brain games and puzzles to challenge memory. Mind Games app, a great collection of mind and training games. I've been told already. A daily yoga app. You can find your personalized yoga class, hit your goals with exclusive yoga classes. Otago app, very, very important. Otago app, Otago is a world-class New Zealand scientists have designed this Otago exercises for senior citizens. And this is world-class evidence-based Otago exercises training program for seniors. Map My Walk app for seniors. This app makes it easy to stay on track. Bodhi Medical Qigong app. Heal your mind and body with Bodhi Medical Qigong app. Qigong is for exercises, slow movement, rhythmic exercises, like it goes parallel to parallel with the Tai Chi. And it will give you very good vibration and you will enjoy doing this. Pain Care app. On the go toolkit for people living with chronic pain, designed to help users regain control of their lives from pain. It offers calming medications, evidence-based training strategies, breathing tools, and tracking functionality. Use it to relax and reflect. This has been one of the best apps, healthcare app. Tell My Geo app. This app will help to track of those with dementia. Helpage SOS app. You know Helpage India, everyone must be knowing Helpage India. No? It's a security app for senior citizens, 24 into 7 days. Save our seniors, emergency help. All these things have been included in this Helpage SOS app. MyFitnessPal app, a recipe calculator allows seniors to check calories while preparing meals. Nimball app, falls prevention exercises app for seniors. Very, very important. Virtual Hope Box app to help people to cope with mood, anxiety, and depression. Fall Alert app on Google Play. App helps in falls detection alert. Falls detection app, ActSoft company. App helps in falls detection alert. Falls Safety Home. It only runs on Apple Watch, Android, and iPhone. Automatic falls detection alert plus emergency alert. Boundary Care, a revolutionary app for enhancing the independence, safety, and well-being of vulnerable individuals used by caregivers, fit for Apple Watch and iPhone. Jana Aushadhi Sugam app, very, very important. Everyone should focus on this, I think. So this app developed by Pharmaceuticals and Medical Devices Bureau of India. This application is designed to provide details of quality generic medicines for all. Honorable Prime Minister Narendra Modi ji has done a lot to Indian population. I would like to share the benefits, 1,759 medicines are being distributed through Jana Aushadhi shops, like managed by Government of India. 1,759 at 50 to 90% with a 50 to 90% discount. Once you install this app, the app will show you, it will show you the location of Jana Aushadhi shops. And you can ask, you can put query whether this is available here, this medicine available here, like that. And this is wonderful system developed by government where these Jana Aushadhi medicines are made available to every person. Many, many thanks for patient participation. Now, what I would like to add at this moment is now this smartphone is getting deleted. US now, US, from US now, one technology is coming up, that is rabbit R technology. Rabbit R technology. So what it will do is, like nowadays everyone has, fond of installing apps now. It becomes very difficult for them to operate. So this rabbit R technology is giving you full benefits, like you just it will allow you to install apps, and the way you operate apps has been made very, very easy, very, very easy, very, very easy. So with this, I thanks a lot to Vayomanasa Sanjeevani team, and I especially Dr. P.T. Shivakumar sir for allowing me to present this much of information to all the participants. And now whatever poster that I have presented in AIMS New Delhi, so it is available with Jammurathan sir. And anyone who is interested, they can share their email to him, and he will send the poster to you. Use it and share your feelings. Thank you.
And doctor, can we just open it for question and answer session, doctor?
Yes, please.
Yes. I mean, anybody who is interested, kindly raise your hands so that, you can raise questions with the doctor and find out his, his response for that.
Actually, the whole explanation of apps is given, to direct you to have awareness of successful aging, and also to lead successful aging, because all these apps are divided into physical fitness, cognitive fitness, spiritual fitness, social fitness, like that, emotional fitness. Very practical.
Anganwadi sir, you can ask, sir.
Doctor, what is the very important apps by prioritizing to seniors to include in the existing Android phone? We cannot have all people iPhone or Apple phone, etc. I may be given some apps which is useful on priority basis. Thank you.
Actually, sir, only one app I mentioned. It is only available on Android, so only available on iPhone and Apple. That is false, regarding false prevention and all. Rest all is available in routine Android phones. And priority, see, you have to prioritize everything. See, you have to maintain your brain fitness, you have to have very good social relation, you have to maintain your mood, you have to maintain anxiety. It's a comprehensive management. So you should have all the apps. And you see, it's very simple. Go to Play Store, install, see how it works. Everything is important. Even like medicine managing, pill dispensing. Sorry, not pill managing. It will give you alarm at right time. Lot of people just forget to take even BP medicines at the right time. So even 1 day or 2 day, if they don't take blood pressure medication at right time, pill reminder app. So what hazards you can expect. So nowadays, and forgetfulness, brain fogginess is increasing now. So all these things, looking into this angle, almost all apps are important. Just it's one way of engaging yourself into exploring a different dimensions of app.
Whether it will give some sounds to remind us on the emergency occasions, whether it will sound us or very only visible messages.
No, it will give alarm. It will give alarm.
Okay. Thank you, Doctor.
I want to ask you, hello?
Yes, I'm listening.
Who is on the line, ma?
Yeah, Padma.
Padma, yes, Padma, madam. You go ahead, ma.
Yeah, we can download all these apps from the Play Store, sir?
Yes, it is a free. You can download all the apps and see the reviews, see how many people have used it and all. It is just an introduction to you to explore all these apps in successful aging dimension. and it is just, kind of spending your meaningful time in exploring the apps instead of going in thousands and thousands of exploring. I have given you the essence of important apps. So the poster is available with Jamunathan sir. Sir, Jamunathan sir, my request is you must be having like mobile numbers of all these participants and email ID. Please send to them.
In fact,
I'm unable to listen.
Sir, once again, I have requested them to share their email ID once again, sir. So that what happens, immediately after every meeting, whoever is sharing the email ID, I just send them the important aspects.
No, I have sent the poster to you. Huh?
Yeah, the poster is with me, sir. Doctor, what I will do is immediately after the meeting is over, whoever sends me the mail, because what is happening is that supposing I send something which is they do not need, then it becomes meaningless.
Okay. Anyone, that's why anyone who is interested, they can send the email to you.
Send the mail to my mail ID. I have given my mail ID also, jambu48@gmail.com. I have again given it in the notice in our the email. Our notice for this particular meeting, as well as I have also given it in the chat, today's chat. Please send a mail to me. As a reply, immediately you will get it. Within say about 24 hours, you will get all of you will get the reply.
What about WhatsApp, sir? You can send on WhatsApp also, no?
See, WhatsApp will I will rather prefer mail, ma'am.
Okay.
I will rather prefer mail because some of the WhatsApp messages they don't reach. So, and then again, there is also a problem with regard to the managing the capacity of the memory capacity of WhatsApp. So certain times it becomes a problem. And therefore, that is why I'm insisting, I'm requesting people to send it by mail so that it is permanent. The record is permanent. At any point of time, one more thing is that one advantage is that because there are so many apps, you can just have the mail and look at the other apps and you can decide which app you need and download those apps alone. Because there are about 50 apps. Many of us may not have the capacity in our mobile phone for downloading all these apps because as of now, we are also using many other apps. So in addition to that, even for Ola booking, we have got an app. Even for attending this meeting, we have got a Zoom app. So like that, we are having so many apps. Therefore, adding these apps also will be a problem. Therefore, what I suggest is you just give me my mail ID, your mail IDs. I will send it by mail so that you just see whether this particular app is needed by you. It's not useful to you. Accordingly, you can use, ma'am. Am I clear, ma'am?
Okay, and even it will be explained like doctor explained for each map, each app what it does.
Yeah. It is available.
Okay.
So, Mr.
Thank you, sir.
Sir, please send mail to my under mail ID. See, it will be difficult to note down this here because what happens even if I make a small mistake, then the mail will not reach you. Therefore, once the mail comes to you, I will send it as a reply to your mail itself, so that you are sure to get it.
We have to send it to you personally?
Yeah, by jambu48@gmail.com. JAMBU48.
Can you send it on the WhatsApp, that email ID?
Yeah, it is there. It is available on the WhatsApp.
Okay.
Thank you, ma'am.
Thank you.
So, any other person?
Sir, actually, I welcome Dr. Anand P. Ambali. He has awardee from Karnataka government, one of the best geriatrician. Dr. Ambali from Bijapur has joined us.
I'm very happy.
Actually,
I'll just pin him, doctor. 1 second. I'll just pin him.
I'm here, sir.
Please welcome. You are welcome, doctor. Hello.
Thank you, sir. Thank you. I am your regular attendee.
Only today I come to know that you are a geriatric specialist, doctor.
Okay. Yes, sir.
has
Thank
been
you, sir.
awarded as one of the best geriatrician from Karnataka government.
Exactly. He is now practicing in Bijapur.
Yes, he has guided me for these apps also.
I see.
A
Hearty
little.
congratulations and thank you.
Thank you. Thanks for that acknowledgement.
Sir, how was the presentation, sir?
Sir, I joined lately, but that was a good common apps for the older people. but many people need to be still aware of these apps. I think through VMS Sanjeevani, again, we are going in roots in creating awareness, and most older people should definitely make benefit of this. And I think your way of talking and all was very conducive. Thank you, sir.
Thank you, Jamuna sir. Okay.
Yes, doctor. Yes, doctor.
I think everyone has appreciated. Thank you very much for joining.
Yes, doctor. Yes, doctor. Yes. And then any other person having, any doubts, please raise. See, doctor, one thing before other people raise a doubt. I just raise, one doubt, doctor. See, use of in today's context, we use lots of apps, doctor. Normally people say that don't spend too much of time on your cell phone, on your mobile, etc., etc. In that context, how far these use of apps are, advisable, doctor, especially for the seniors.
See, that you have to decide now, because what senior should do is make yourself busy in meaningful activities. So that is always there. If you expose yourself constantly with cell phone, that may makes you even dry eye syndrome, and makes you anxious. You may lose sleep because of the light which gets emitted from the mobiles and even laptop. Also, it affects the melatonin secretion. So that you have to decide how much to use. And I don't think all these apps are to be used daily, and it will just for the education. It will educate you, like pill reminder app. Yes, it will not make a difference whether you see it a mobile or not. It will just remind you, just give you bell. This is a time for this, this is a time for this. And once, for example, Otago exercise app, it will just teach you what to do, and you have to restrict yourself how much to use. You understand, once you learn the technique of Otago, you need not use that app, something like that.
Yes, I understand. Therefore, I think that the word of caution also we need to tell people that, okay, you decide what is the app, what are all the apps that you need, and definitely we need to restrain ourselves from using these cell phones for a long time. Isn't it? Isn't it, doctor?
Yeah.
So that, that kind of exercise we only need to do.
Yeah.
Yeah.
And it's a actually, another thing is, by using these apps, you will become more creative. You will come to know what exactly is useful for you, and whatever that is useful for you, that only we compiled.
Yeah,
And
I understand, doctor. I understand. Again, it has to be specified to any individual. So whoever needs whatever app, those apps only people should use.
yeah.
There is no need to, see, supposing I don't take many pills, I don't need to go in for these pills apps.
Yes. That is understood.
And supposing I am not taking care of any other person, then I don't need this caretaker app.
See, whatever compilation of apps that we made, once you receive the poster by WhatsApp or email, you can circulate it to your friends.
Yes, doctor. Yes,
They will use it now, because of the limitation of time and limitation of their activity. They must not have joined this Vayomanasa Sanjeevani Zoom meeting,
Yes,
but
doctor.
at least they will be benefited. That's what I want to say.
In fact, we try to, spread this information to as many people as possible, doctor.
And they can actually, they can also interact with their friends, and they can just have chat also. No.
Yeah, sure, definitely. And once, somebody starts using it, they will definitely understand the benefit of this.
Yeah.
So then they may not, spend much time on other apps also, or other, unproductive WhatsApp messages, these things, etc. Because these apps provide very authentic information. Otherwise, what happens, many messages we receive from WhatsApp, and we do not know how authentic those messages are. Most of the occasions, they may not be correct also.
Yeah.
So in such a situation, I think it is better that we use apps that are,
Actually, I am going to discuss with Dr. P.T. Shivakumar sir that to conduct very large study in Bangalore, public utility, public health importance of these apps. So, but the only thing is, like he also needs very good team to work on this. So, like Bangalore is a senior citizen hub and IT hub also. So, if senior citizens are motivated to use these apps, their quality of life improves.
Exactly, Dr. Nand. We might also get very number of volunteers for this.
Yes, yes.
This is one advantage of Bangalore is that in fact, number of volunteering activities are taking place. And especially in this field and even in our NIMHANS, at the same time, several departments are there, and many of them are doing they are taking lots of volunteers, and many of them are doing some work. Therefore, I think that one advantage with Bangalore is that these kinds of volunteers. In fact, it is a very good initiative. We'll, we only look forward to, your starting this at the journey at the earliest, Doctor.
Okay.
Sir, PMG, who is that? I don't understand.
Yes, Jamunathan, sir. Thanks for the time you given for me. This presentation up to the current trending. What you was telling that successful aging or productive aging or healthy aging, what we talk about now, the internet-based or mobile-based or app-based package, no, it's nowadays opting for the elderly people over wherever they're staying, because covering offline or in person, it is very difficult. That's why the WHO itself told about in the healthy aging decade, no, 21 to 30, what we are declaring, reaching the people any mode. It's not necessary we have to in person, we have to meet. That's why they're telling multi-sectorial and multi-dimensional. That's why they're telling all public, media, professionals, whichever stakeholders are there, no, we have to connect them. So these apps are well determined. Even though recently our senior PhD scholar, she done her study on dementia. She done a study on support network. This also through online. She used the Zoom platform and she tried to connect the people to how to get benefited. The caregivers came together and they discussed among them. So how to get supported among them. So that's why nowadays app is not only helping the general population, it's also helping the any generation, even our child to adolescent till the elderly people. And app is coming in a user friendly. There are a lot of people talk about addiction, internet overuse, so many things. But this is one of the mode. See, we are not telling this is an ultimate mode. But whenever people, one person sitting alone, instead of sitting alone and isolated, he can get connected through internet and apps, and he can schedule his activities. We are saying that let it be a complementary. And that way, this presentation very wonderful and aptly prepared for this time. And I also enjoyed the slides also. Then good that you sharing the slides. Anybody can understand and learn. Thank you, the presenter and the anchor and all other audience who made this time good. Thank you.
Thank you, sir. May I know your name, sir?
1 second, Mr. Jamunathan. Am I audible?
Yeah, 1 second, sir. 1 second. I'll come back to you. I'll come to you, sir. I'll come to you. Rangapatal, sir, I'll come to you.
Nice.
Sir,
Can you send the email ID of the geriatric physician Jamunathan, sir?
Pardon me?
You introduced a geriatric physician just a little while ago.
Dr. Anand P. Amblis, na? I will send his email ID to Jamunathan sir. I will send email ID to Jamunathan sir, and through him you can take.
Okay.
Okay. Sir, Rangapatal.
Just I want 1 second. What precautions we have to take by using the apps? Because I am worried about whether it is being hacked by our personal information should not be leaked out. So I would just like you to kindly entertain me about how such things are to be managed.
Sir, your question is not very clear, sir. Can you just come again?
Yes, please.
Please come. Tell me, sir. Once again, please come again, sir.
Okay.
Sir, I will repeat the sir's question. Sir was worried about his safety of the apps, whether they can hack your details or how safe are these apps.
Yes.
That's a very good question, sir. I understand.
That's what I did.
Yeah, I understand. I understand.
Yes.
Okay.
Yes.
See, these are all these apps. I will request doctor to respond to it. But before that, my response is that, see, there is no need at all. There is no need to worry about that at all, because these are all, you are all downloading it only from app stores, Google app stores, Google stores. So there, what happens, these the store generally verifies the quality of these apps, and they ensure that it is, it is not, it is free. It is free from any such type of activities, that is hacking activity. But anyway, I would request Dr. Mahesh to respond. Sir, Dr.
See, in cybercrime, in the world of cybercrime, anything can happen. I don't say that this cannot happen. But see, the thing is, all these things needs to be considered, and keep only those apps which are helpful to you. And keep in mind, but all these negative things does not happen. Just download the app, suddenly your account, your money will go. It's not like that. It's not like that. See, you have to just watch. You have just watch and use it, and just delete it, whatever that is not useful to you.
Great.
So that is perhaps one of the important take-home points, so that we are always on guard about what we are using in our mobile phone. So as Doctor has said, nothing is 100% sure in this cyber world.
That is always there. That is always there.
That is always there.
Especially these video games. I just these are all video game apps and all these things. And sometimes people say, but it's not that the moment you download that app, your money will go. It's not like that. See, so many things has to be considered, and use it. And once you feel that it's not useful, just delete it. That's what I would say. Like to comment on this cybercrime and app?
So anybody can, he is welcome.
No, it doesn't happen, no? Nini, actually, I'm sitting in one of our studio, and we have an IT professional here. Your brother, good name? Mandeep Bhai. I'm asking him, they say that if you download app, cybercrime can happen.
No, नहीं हो सकता, because जब तक आप कुछ ऐसे एक्टिविटी जैसे लिंक शेयर करना, और जब तक ये नहीं होता तब तक ये पूरा safe है.
What our IT professionals say is, unless and until you share a link,
or click over something,
a click over some unusual information, then the problem can start. Otherwise, it will not. It is absolutely safe. You are not actually. We are organizing this program with the help of our IT professional, Mandeep Bhai. He says he is happy with this.
In fact, I don't know, Dr. C. In fact, as an ex-banker, my request to all our friends here is that never share, never click any link that you are getting. The problem starts only when you are clicking a link. If you want to visit your bank, please straight away go to your website, web, and write your bank's name, and then go to the website. Never click any link, because any type of fraud happens only because of these kinds of links. And the links contain very, very similar name, but there will be a small difference. That difference, 99.9%, we will not be able to locate. Therefore, they conduct all frauds only through this kind of links. Therefore, my request is that so long as you do not click any link, you are very safe. So long as you are going to do your cyber transactions, you are through the website of the bank, authorized website of the bank, you are safe. Therefore, that, and you know, many of the banks have also promoted apps. So, and it is always better to go through that particular app. Say, for example, Canara Bank, they have got their own app. State Bank of India, they have got their own app, like that. So, app is always something that is directly between you and the bank. So, this is one additional safety layers is available for an app. Therefore, 99.9%, I have not come across any cyber claim that has happened because of usage of any good app. We are downloading from very authorized sources. Please, whenever you are downloading an app, please do not download an app from a link. Please do not do that. Go to Google stores, then if then app stores or Google stores, then download your app. Then you are 100% safe. And they also give you a link. They also say, give you a certificate stating this app is clean. Therefore, you will have to wait for that certification and accordingly install the app. Probably we'll have a separate session on how to install an app also. We'll soon try to have a session on that. So any other person having any doubts, sir? Any other question? Sir, Vendotal sir, are you now clear? Hello? Vendotal sir?
Yes, sir. I'm able to now. It has been clarified by you.
You are able to clear? Okay.
Yes, I will contact you also later. So.
Okay. You are welcome. You are always welcome, sir. No problem at all.
So kind of you. You are always so very.
No, you are always welcome, sir. We are here only to the extent possible. We will always support, sir.
So kind of you.
So any other person having any other doubts, sir? Madam, doctor, sir. Otherwise, we can close the session. That's why I'm asking. Now, Dr. Saab, Anand Saab, Dr. Anand Saab.
Yes, sir.
Can you just send a mail to my mail ID, Doctor?
Sure, sir. I'll do it. I have put it in the chat box.
Yeah, you have put it in the chat box. What happens, Doctor? While we are copying it from the chat box, certain times mistakes happen. And
I will send. Huh?
I am requesting, Doctor. Sorry for an additional work. Sorry for that.
No problem. We are always up.
Method of sharing information. So, sir, you have got any doubts, sir?
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 No, nothing.
Nothing. Okay. Because you are one more IT specialist. You have been using all these things largely. That is why I thought of asking you, sir.
Just an addition to all the things you have mentioned, Jamunathan sir.
Yes, sir.
Seniors should take one precaution that the helpline numbers are never the mobile numbers.
Yes.
Senior citizens should always remember the helpline numbers for any for their matter, whether it's a bank helpline or any helpline number or customer care number. They are always a land phone number. They are never mobile number. So seniors should avoid responding to the mobile numbers. They should always entertain the phone that has come from the land phone and not from the mobile.
Yeah,
that's what I can do.
That's a good information.
That's a very good input.
Yeah.
It will be very useful for all. Very practical one.
I never thought of this so far, but it's very good information. Thank you.
Yes, thank you, sir.
Doctor, one thing more I can add is that Mr. Surendra Pai is a retired DGM from Canara Bank.
Thank you.
Yeah. So he himself is saying that. So to that extent, it's a very practical one, doctor. I appreciate you for that, for flagging it at the appropriate time, doctor. Thank you for that.
One picture we have done. I just want to share this photo. We have put it in our OPD. Do's and don'ts with a smartphone. Okay. And I think, is it visible here? Yeah.
Can't read it, but anyway, it's visible. Can't read.
Yeah, I think I will share this. We have just written, remember, helplines are always landline. And call cyber helpline 1930. And don't attend video call by unknown number. Don't share your PIN number. Don't call back suspicious number. Don't call back missed number, which are not there in your list. Don't call back them, ask who are you. Do not share OTP. Don't get lured by promotion messages like lottery, winning numbers, and discount offers. Do not share PAN or other details to anybody on the phone. Don't accept friend request on social media unless you know them. And don't transfer money online to the unknown person or number. This is this big chart we have made and placed in our OPD for only creating awareness about use of smartphone for the senior citizens.
Doctor, I would request I would make one request, doctor. Kindly
Yes, sir.
take a picture of that and send it across to me. I will share it with all my people.
Yeah,
Sure, sir. Definitely. I'll do that, sir. I'll do that. A pleasure.
My mail ID, if it comes, I will share it, and I will also keep it for my own guidance, doctor.
Yes, sir. Sure, sir. I'll do it, sir. I'll do it.
Good job, doctor, on that.
Thank you, sir.
These are all the basic precautions that a person is expected to take before using online facility. Thank you, doctor.
Yes.
Thank you. Thank you.
Thank you.
So, any other person having any other doubt, or we can close down?
Where does he practice, sir? Doctor?
Huh?
Where does he practice, Dr. Anand?
Vijaypura.
Suppose we want
North Karnataka.
Suppose I want a family physician in JP Nagar. Can he guide me with that?
Which Nagar, madam?
JP Nagar, second phase in Bangalore.
I will get it. I'll get in touch with you, madam. Right now, JP Nagar, I don't know, but I am in Vijaypura. Okay. I will let you know from my circle.
Sure, sir. Thank you, sir.
Okay, sir. Good evening. Thank you, one and all.
Thank you.
Thank you.